So this is a case study of a patient who needs a hump reduction, but also needs a tip rotation procedure done as well. So in the preoperative analysis, I could see that this patient's bridge was a little bit too high, and also the angle that her tip made between her upper lip and the tip of her nose was probably a little too acute. So we call that ptosis. So she had a little bit of ptotic nasal tip. Otherwise, the tip itself and the relationships between the two sides of the tip was quite normal. So what I'd recommended was hump reduction and tip rotation. So for the hump reduction, as we mentioned in previous videos, we basically take away some of the cartilage and bone that forms the hump, and then we perform osteotomies on the sides of the sidewalls of the nose to actually narrow the nose again back to its original position. Now in her case, if we had done just the hump reduction, then we would end up with a fairly straight dorsal profile, but in a way it kind of accentuates the droopiness of the tip. So for her, I also wanted to elevate the tip upward, and we had made that decision preoperatively. So this is if we had just done the hump reduction. And now what I want to show is how we rotate the tip in an upward direction. So essentially in her case, what we did was we took the central part of her nasal tip, which is really this columella, and we actually tilted it backwards, and we resuspended it onto her nasal septum. So I'll show you how that's done. Essentially the cartilages were tilting down a little too much, so they were separated from the underlying septum, which normally holds the tip and bridge, and was replaced and repositioned in a higher orientation, and that's secured in place with stitches that are there permanently, and that's all done underneath the skin, of course. So what you see in the patient is that we take the nasal tip cartilages that are tilted downward slightly, and we just elevate them a little bit, so that I think you can probably see the difference between those two slides, but that will elevate the tip. And this is the actual results of the patient. So beforehand she's got a high bridge and a ptotic tip, whereas now our bridge is straight and we've tilted her tip upwards. And you'll see on her 3/4 views as well, that gives her a very nice result, makes her nose look quite a bit smaller.